So today we have this painful pincer nail on this young lady. She's had it for some time. ¿Te duele aquí?
¿Te duele ahí? No.
No?
No.
Good, good block. Alexa's here helping me out because my Spanish is not that great. But Alexa gave the block already. So she gave the block already. She's not having any pain. Very good. But as we look here, we see that the nail, instead of growing out flat like on her left big toe, the nail's going straight down. And curved here on the end and going straight down on this side as well. So a lot of people who have this issue can be very painful. Okay, still no pain?
Todavía no siento nada al frente. No, no pain.
Good, good, good. Okay, so before when we took care of this for her, we just removed the sides. It came back with a vengeance. So today we're going to remove the entire nail so that it's feeling better. What she also has is this chronic swelling of the nail folds, which makes it almost impossible for the nail to grow out flat and clear the ends here, so the nails continue to grow out into the skin. So what we're going to do is remove the nail, do an aggressive soaking treatment at home to get these nail folds to hopefully go down to normal size so the nail can get over this end. Just really pinching all the way under here. Okay. All right, let's see how everything's going. See how good our tourniquet is. All right. So first we have to loosen the toenail, the nail plate, from its attachments under the proximal nail fold. The proximal nail fold is this fold of skin where you also find the cuticle. And loosen this up. Okay? Mm-hmm. Okay, good. Get it good and loose here. And we have a good tourniquet because we've loosened it up here. We're not seeing any bleeding to this point, so that's good. All right. So now we need to loosen the nail from its attachments underneath. So I come under the nail here. And it's really pinched in there. I make sure that my instrument points upward against the nail, not the underlying skin. See how it's got a little bend, a little curve. So you want to make sure that the curvature is up toward the nail plate, not down toward the skin. There we go. I can feel that the nail is getting loose. Sometimes it can be a little tight. And that's okay, that's very normal. There we go. Okay. Looks like it got freed up pretty well here. And the goal is to remove the nail in one piece instead of having to actually cut it into multiple pieces. Now that the nail is loose, I can show you how the corner is way under there. Why it's so painful, especially inside of shoes. See that there? See that there? So that corner goes down into the skin. You can imagine wearing shoes with every step. It can be excruciating. Can she see that? Señora.
¿Puede ver la uña que está bien curvada en la esquina?
Yeah, it's all the way under there.
Es la uña.
And the same thing on this side.
Y es lo mismo en el otro lado igual.
See that? Look at that. You can really see it there.
Su uña está bien curvada, puede ver ahorita en las esquinas, está bien curvada.
So all of this nail here is buried under the skin.
Toda esa uña está adentro, enganado en su piel.
And so as you get pressure here, it gets very painful.
Entonces cuando usted pone presión, cuando camina, siente el dolor.
Okay. So which is why since it's a very large piece on both sides, we got to move the entire nail today.
Como están en los dos lados, él le va a quitar toda la uña ahora.
Okay, so let me just do one more check of the looseness of the nail. Okay, so now it's coming loose now. Still a little bit tight in this corner over here. All right. There we go. Now what I like to do is go in here and pull the nail back. See that? There it goes. Sometimes the corners are hard to get out. There we go. And then you just roll it from one side. So grab it, just roll it out. And if it's still kind of attached with the skin, you just use a scissor.
¿Cómo se siente? ¿Todo bien? Still no pain.
Good. And just release it from its attachments. And there it is. Now, you can really appreciate now the pinching of the nail. All right. You see that there, how it really comes down. If you look here, look at that. All this is curling down underneath the skin.
Todo eso está encarnado en su piel.
Okay, and you look at it from the bottom, you can really see how these edges, and they're very sharp.
Y están bien filos.
Okay, so that's why they're so painful. All right, so now we take a look at the underlying nail bed, make sure there's no significant injury there. We just gotta deal with some of the loose skin. There we go. Now, the question of the day in a case like this is what would cause this one nail out of all 10 of her nails to be pincher and the other 9 normal. And most of the time when we see that, it's because of influence of the underlying bone. Okay, just getting this loose skin up here. If the bone underneath the toenail is sticking up or has a spur on the top of it, it'll cause what we call a tent pole effect. So this nail here, the bone underneath, let's say our instrument here is the underlying bone, it pushes up on the nail like so. And so as the nail gets pushed up, the sides go down instead of out flat. That's what's happening there. But everything's good here, nice and dry.
So when the nail grows back, is it going to be curved?
Well, it probably will, because the issue, the underlying bone is still there.
Ya no hay más de cortar en las
Right.
No, ya no hay más para cortar.
So this is the first time remove the entire nail. So we will see how it grows back. On the big toe, I don't like permanently removing the entire nail unless it's, you know, really a problem, because that nail protects the underlying bone. This is the nail bed, and there's not much skin between the nail bed and the underlying bone. And there's no fat, there's no fascia, there's nothing else. The only thing that's protecting this underlying bone now that the nail plate is gone is the skin. And if the skin breaks down, that's how you can get a bone infection, which we typically don't like to do permanent nail removal on the toes if we can avoid it, of the entire toenail, but definitely not the big toe, because the big toe takes a lot of beating every day inside of our shoes. All right, so we'll keep it wrapped, we'll protect it. Put some antibiotic ointment. So starting tomorrow, she'll start the soaks with the Epsom salt to help it dry out once a day for 30 minutes, once or twice a day for 30 minutes. Put the antibiotic ointment and cover it with a Band-Aid. We do expect there to be a bit of bleeding today, so we'll put a full bandage on it today, and she can just start using a regular Band-Aid tomorrow. A lot of people ask, well, is she going to be in a lot of pain? And the answer most of the time is no. And the reason why that is because there's no cutting of the skin. There's no knife. There's no incision. So there's no pain that way. So we most of the time don't even have to give the patient pain medication.
Oh.
She have a question?
No, her leg fell asleep.
Or knee fell asleep? Okay, leg fell asleep. Okay.
Por hoy va a usar esto, ya como está en la mañana puede usar una curita regular para cubrirlos. Se va a se va a mantener los pies en agua 2 veces al día por media hora con agua tibia y sal, Epsom salt. Okay. Y Nesporin, y después se cura de vuelta con una curita cada día.
No me gusta nada. Aumentarme algo, solo curita, no me gusta.
No, el Nesporin si tiene.
No.
Okay.
So this dressing will come off tomorrow morning.
So eso se le puede quitar mañana.
And start the soaks and the antibiotic ointment.
Poniendo su pie en agua mañana igualmente.
And that's it.
Y eso es todo.
See you back in a week.
Mira, cuando llego a la casa, llego bien. Veía aquí como ya en la tarde y siento que me duele.
No, sí, ya.
El dolor no da él aquí para tomar.
Pero no debería de tener mucho dolor porque él no le cortó mucho la piel, solo le quitó la uña. She's asking about pain.
Oh, okay.
And I'm telling her she shouldn't be having any pain. Pero si le siente que le duele, puede tomar como Motrin o Tylenol, algo pequeño, no es mucho.
And that's it, my friends. We'll see you back in a week. Make sure everything's okay.
En una semana para asegurarse que no hay infección o que todo está bien, ¿ok?
En una semana,
En una semana. Se va a regresar el próximo viernes para la chiquita.
Okay.
Okay, señor, okay?
Okay.
Yeah.
Gracias.
Gracias, de nada. This is Kevin Jefferson, the DC Foot Doctor. Thank you for watching this video. Like it with a big thumbs up. To see very interesting cases and my approach and techniques to dealing with them, and to learn how you can improve your foot health, subscribe to the channel. Ring the bell so you will know when a new video has been uploaded. Follow me on social media at DC Foot Doctor. Most importantly, take care of your feet.